In releasing this map and information, Boulder County also said it would work toward a location-based cell phone alert that you do not need to sign up for, the kind that we get for weather warnings and amber alerts. As the Marshall Fire spread, a line of ambulances, 40 to 50 deep, waited in the parking lot of Good Samaritan Hospital. An entire intensive care unit was evacuated in Lafayette. Doctors and nurses feared the flames could overtake the hospital. They had to transfer the sickest patients in a matter of minutes. Here's Mark Salinger.
Very quickly, it turned into a whirlwind of what do we do next? How do we support our staff? How do we support our patients and their families?
The fire burned quickly. Directly in its path was Good Samaritan Hospital. As the flames approached, the hospital made the decision to begin evacuating patients.
It went from controlled chaos to just a controlled, normal ICU day of this is what we have to do, so let's get it done.
Heather Dose is a clinical nurse manager. She was working in the ICU Thursday.
There was an ambulance line of no shorter than 40 and 50 ambulances sitting in the parking lot just waiting for us to tell them which patients to take.
55 would be evacuated to other hospitals. The sickest went first.
Of those patients, about 18, 19 of them were extremely sick on ventilators.
No, it's not good when the OR smells like smoke. That's a problem.
Dr. Daniel Posley was preparing for surgery when he could tell something was wrong from inside the operating room.
The last time I had a surgery stopped was in Afghanistan, and there you do smell smoke often, so it really brought me back to that.
He went home to evacuate his own family.
Being a surgeon, you have two families, your own family and then your patients, right? So I'm thinking about my family, about my patients, and then you're thinking about the community. You know, I live minutes from here.
We prepare for a lot of things, right? Our emergency plans are broad.
Hospitals prepare for everything. Even for Brian Fleming, a fire like this was unexpected. He's the Assistant Director of Emergency Management for SCL Health.
Most of our response preparedness around fires is to receive patients from those events. And this actually threatened, the community and the facility itself.
The fire spared the hospital when the winds calmed down.
We were very, very lucky, though.
By that point, the ICU was empty.
And we looked at the board, and it's the first time I've ever, in my 9 years here at Good Sam, seen that board in the ICU be completely empty with no patient names. And I think that's when it hit all of us that, wow, this is what we just did, and we did it to keep our patients safe.
Since this was such an unprecedented event, they're using it to update their emergency procedures and look at what went right and what they could do differently. Urban wildfires don't happen very often, but this fire showed that it is possible and they need to be prepared. Marshall?
Now, Mark, I know that Avista was evacuating patients first, and we've got COVID going on. How difficult was it to find space at other hospitals?
Yeah, SCL has 3 hospitals across the metro area. All 3 of them went on to the emergency procedures that they were trying to find space for all these different patients that were transferring to other hospitals. Of course, all of these hospitals are dealing with staffing shortages as well as shortages in places that patients can go to because of COVID. So it's not exactly the easiest thing to do in the middle of a pandemic and a raging wildfire.